Hello and welcome to this webinar on leptospirosis, brought to you by Leading Sheep and the Livestock Biosecurity Network. My name's Sarah Jane and I'm the Regional Manager for LBN in Northern Australia. Leptospirosis is caused by the bacteria Leptospira and can affect almost all mammals. There are over 200 strains of lepto around the world, and what we commonly see affecting production animals in Australia are two strains called Leptoharjo and Leptopomona. Infected animals can carry the bacteria for long periods without showing any clinical signs. The bacteria colonise in the kidneys and the animals shed them in urine and at birth or during abortions and thus contaminate the environment. Many infected animals don't display any clinical signs of illness, and these apparently healthy but carrier animals are the main source of infection for other animals as well as humans. The disease can be spread from animals to humans in a number of ways, which include via broken skin, such as in cuts and abrasions, handling aborted fetuses or afterbirth, or assisting with carving or lambing without gloves, poor hygiene practices, such as not washing hands properly after contact with livestock, indirectly via infected soil or water, or when urine from infected stock reaches the eyes, mouth, or nasal passage of a human. The bacteria can live for a long time in surface water, damp soil, vegetation, and also mud, but they are very quickly killed in dry soil or by sunlight. Flooding after heavy rainfall can spread the bacteria to previously uninfected farms. Outbreaks of lepto are therefore more common in the wet years. Even closed herds are not completely safe, particularly in flood times, as water from other properties can carry lepto onto the farm. The clinical signs of lepto in cattle will depend to some extent on the strain of lepto in which the animal is infected with. Both Leptoharjo and Leptopomona can cause late-term abortion. Red water, or blood in the urine, in cattle, and particularly in calves, strongly suggests infection with Leptopomona. Often there is also onset of clinical signs, including red water, lethargy, anemia, and sometimes jaundice, or yellowing of the mucous membranes of the eyes and mouth. Sudden death in young stock also may occur. Not all severely infected animals will die, however, and sometimes the symptoms of red water may pass after a few days. Leptospiral infections can also cause mastitis and decrease milk production, as well as reduce fertility. It can also be responsible for losses of conditions if the bacteria cause persistent kidney damage. Leptospira is considered rare in sheep and goats, but it hasn't been investigated as intensively as in cattle because clinical illness in sheep is not a major problem and sheep are considered to be less of a zoonotic risk or a risk to human infection. Leptoharjo can be transmitted between sheep from infected cattle, so that would be stock in close contact in the right environmental conditions. Sheep can also maintain the disease within the flock as they are often asymptomatic. Infections of Leptopomona in sheep can cause abortions, perinatal death, renal disease, anemia, and jaundice. Being a zoonotic disease, vaccination is the best prevention strategy, and that includes looking to purchase pre-vaccinated animals if possible. There are a number of vaccination preparations available, which include singular LeptoShield or lepto-only vaccinations, as well as combined products such as 7-in-1, where lepto vaccinations are combined with vaccination for clostridial diseases. Lepto is more likely to occur in conditions where you have movement of infected animals into or amongst the herd or a flock, properties that are trading cattle, sheep or goats in conjunction with a local breeding herd, if there is contact with a wildlife reservoir, such as feral pigs, if there's a previous history of lepto in the herd or flock, if there's access to wet areas where the bacteria are able to survive, in regions where there's a hot, humid climate and areas where it's likely to have flooding or wet and boggy grounds, and also farm workers and vets handling animals shedding the bacteria are more likely to be at risk of contacting the disease. If you have any questions on lepto, please contact me at sjwilson@lbn.org.au. I've also provided some resources on vaccination from MLA, Making More from Sheep and Future Beef. Thank you for listening to this webinar on leptospirosis. If you have any questions, please contact me.